Welcome to the Slop Farm. Enjoy the video.
You start by confirming key signs: ear pain, fever, muffled hearing, and how long symptoms have lasted. Once you have that, give immediate symptomatic relief with age-appropriate acetaminophen or ibuprofen and a warm compress to reduce discomfort. Make sure to call your primary care or urgent clinic within 24 to 48 hours so a clinician can examine the ear and decide if further treatment, such as observation, prescriptions, or testing, is needed. You follow the clinician's assessment, which usually includes otoscopic inspection to see the tympanic membrane and judge bacterial versus viral cause. If diagnosed bacterial, start the prescribed oral antibiotic and adhere strictly to the dosing schedule for the full course. Stopping early can cause relapse. Once done, use recommended ear drops only if the provider confirms the eardrum is intact. Make sure to ask about nasal saline, decongestants, and follow-up. You complete the treatment and monitor progress. Most people improve within 48 to 72 hours. If pain, fever, or hearing loss persists, return for reassessment because persistent effusion or recurrent infections may need ENT referral. An ENT may recommend myringotomy with or without tympanostomy tubes for chronic cases to prevent hearing problems. Troubleshooting tip: if sudden severe pain, new drainage, or high fever occurs, seek urgent care immediately. These are signs that complicate.
Thanks for watching. Consider subscribing if we helped you today.